Hello all, hope you're doing well today. Today we are talking about chapter 6, continuing our conversation. This is over glutamine and creatine supplementation. Here we go. Glutamine is a non-essential amino acid. It is the most abundant amino acid in the plasma. It represents about 60% of the body's amino acid pool. Glutamine, like alanine, is synthesized in the muscle tissue where it is found in high concentrations and is a major means for removing excess amino groups from the muscle, delivering the amino groups to the liver and kidneys for excretion or reuse of excess nitrogen. It's also an important fuel for the immune system. Glutamine appears to be involved in the regulation of a number of metabolic processes important to exercise. Oral glutamine supplementation has been shown to increase HGH levels, and glutamine may also stimulate protein synthesis by increasing muscle cell volume. However, several studies indicate that neither short-term nor long-term glutamine supplementation has an ergogenic effect on muscle mass or strength performance. Additionally, alpha-ketoglutarate, a precursor of glutamine, has been theorized to be anabolic, but no data are available to support this theory. Potassium and magnesium aspartate are salts of aspartic acid, a non-essential amino acid. Although the mechanism has not been clearly documented, these substances have been postulated to improve aerobic and anaerobic exercise performance, possibly by enhancing fatty acid metabolism and thereby sparing glycogen. By reducing accumulation of ammonia, which is a metabolic byproduct of protein, or simply by improving psychological motivation, the ammonia hypothesis has been tested in several studies since increases in serum ammonia have been associated with muscular fatigue. Although, as noted previously, this mechanism is not necessarily clear. Research findings relative to the ergogenic effect of acute short-term supplementation of aspartates are equivocal. A number of both early and contemporary studies have reported no beneficial effects of aspartate supplementation. And review Trudeau noted that the effect of aspartate supplementation on endurance seems generally favorable in humans, but the underlying mechanism for performance enhancement has not been confirmed. It appears that additional quality research is needed to evaluate the ability of aspartates to exert an ergogenic effect. Dosage may be a key factor, as dosages of about 10 grams have usually been associated with improved performance. You're also starting to see in research now that the announcements, according to research that they have done, that aspartame, which is linked to aspartate, has been shown to be carcinogenic. Now, that's when you are taking extreme dosages of aspartame. So, and when I say that, I mean you're drinking many sodas a day, not just one or two. So, just something to be aware of. Glycine is an amino acid and one of the building blocks of proteins. It is the simplest and smallest amino acid, consisting of a single hydrogen atom as its side chain. Glycine is considered non-essential, which means that the human body can produce it on its own. In addition to its role in protein synthesis, glycine has several other important functions in the body. It is involved in the synthesis of DNA, RNA, and various important compounds, including creatine, porphyrines, and glutathione. Glycine also acts as a neurotransmitter in the central nervous system, where it plays a role in regulating brain function. Glycine is found naturally in many protein-rich foods, such as meat, fish, dairy products, and legumes. It is also available as a dietary supplement, and it's sometimes used in the food industry as a flavor enhancer or sweetener due to its sweet taste. As a supplement, glycine has been studied for its potential health benefits. Some research suggests that it may have a calming effect on the brain and could help improve sleep quality. It has also been investigated for its potential role in supporting collagen production and promoting healthy skin, joints, and muscles. However, further research is needed to fully understand these potential benefits. Glycine is one of the major inhibitory neurotransmitters in the CNS system. It functions by blocking or inhibiting certain signals in the brain and spinal cord. Imbalances or dysfunctions in glycine neurotransmission have been implicated in various neurological and psychiatric conditions, including schizophrenia, epilepsy, and sleep disorders. Glycine acts as a co-agonist for NMDA receptors, which are important for synaptic plasticity and memory formation. The glycine site on the NMDA receptor is essential for its proper functioning. Alterations in glycine availability or NMDA receptor functioning have been proposed as factors in certain neurological and neuropsychiatric disorders. Glycine plays a crucial role in the synthesis of collagen, a major structural protein found in connective tissues such as skin, tendons, and bones. Collagen provides strength and stability to these tissues. Deficiencies in glycine or disruptions in collagen synthesis can lead to connective tissue disorders such as Ehlers-Danlos syndrome. Glycine has been the subject of numerous research studies, and here are some of the main research findings related to glycine. Glycine has been studied for its potential effects on sleep quality and mental health. Research suggests that taking glycine before bedtime may improve sleep quality, reduce the time it takes to fall asleep, and enhance daytime performance. It has also shown promise in reducing symptoms of schizophrenia and improving cognition in individuals with schizophrenia. Glycine has been investigated for its neuroprotective properties. Studies have shown that glycine can protect against neuronal damage and improve outcomes in animal models of stroke, traumatic brain injury, and neurodegenerative diseases like Alzheimer's and Parkinson's. It may help reduce inflammation, oxidative stress, and toxicity in the brain. Glycine is also an essential component of collagen, and research has explored its role in collagen synthesis and skin health. Studies suggest that supplementation may enhance collagen production, improve skin elasticity, and promote wound healing. It may also have anti-aging effects by reducing the appearance of wrinkles and promoting youthful skin that we all want. Glycine has been investigated for its potential anti-inflammatory role and its role in maintaining gut health. It may help reduce inflammation in the gastrointestinal tract, improve intestinal barrier function, and modulate the gut microbiota. These properties have led to research exploring glycine's potential in managing conditions like inflammatory bowel disease or IBD. Some studies have examined the effects of glycine on sports performance and muscle protein synthesis. Glycine supplementation has shown potential in enhancing exercise performance, reducing muscle damage, and supporting muscle protein synthesis. It may improve recovery after strenuous exercise. Glucosamine and chondroitin are dietary supplements commonly used to support joint health, particularly in individuals with osteoarthritis, a degenerative joint condition. Here's some information about glucosamine and chondroitin. Glucosamine is a naturally occurring compound found in the body, specifically in the cartilage, which is the flexible tissue that cushions the joints. Glucosamine is involved in the formation and repair of cartilage. Glucosamine supplements are typically derived from shellfish shells, such as shrimp or crab, or made synthetically. The primary form of glucosamine used in supplements is glucosamine sulfate. It is believed to provide the building blocks for cartilage repair and help maintain the structural integrity of joints. Glucosamine supplements are available in various forms, including oral, capsules, tablets, or liquids. Chondroitin is a natural component of cartilage and is often found in combination with glucosamine in joint health supplements. It is a large molecule that helps give cartilage its elasticity and cushioning properties. Chondroitin supplements are typically made from animal sources such as cow cartilage or short cartilage, or it can be synthesized. Chondroitin sulfate is the most common form used in supplements. It is believed to help slow down the breakdown of cartilage, reduce inflammation, and improve joint mobility. Like glucosamine, chondroitin is available in various oral supplement forms. When taken together, glucosamine and chondroitin are often used as a combination therapy for joint health. The rationale behind their use is that they may help reduce pain, improve joint function, and slow down the progression of osteoarthritis. While many individuals report benefits from glucosamine and chondroitin supplementation, scientific evidence on their effectiveness is mixed. Some studies have shown modest improvements in pain and function, particularly in individuals with moderate to severe osteoarthritis, while others have not found significant benefits compared to placebo. It's important to note that the effects of glucosamine and chondroitin may vary among individuals, and the supplements may take time to show noticeable effects, typically several weeks or months. As with any dietary supplements, it's advisable to consult with a healthcare professional before starting glucosamine or chondroitin supplementation, especially if your client has any pre-existing medical conditions or are taking other medications. Additionally, it's essential to maintain a well-rounded approach to joint health, including regular exercise, maintaining healthy weight, and following a balanced diet that includes adequate nutrients for joint support. The majority of research on glucosamine and chondroitin has been conducted in older individuals with osteoarthritis or other joint-related conditions. These studies have investigated the potential benefits of these supplements in relieving symptoms and improving joint function in those specific populations. The research on the effectiveness of glucosamine and chondroitin in highly trained individuals, such as athletes or individuals engaged in intense exercise, is more limited. There is a lack of robust scientific evidence specifically focused on the effects of these supplements in highly trained or younger individuals without pre-existing joint conditions. However, it is worth noting that joint health and the potential benefits of glucosamine and chondroitin are not limited to individuals with osteoarthritis or age-related joint degeneration. Intense exercise, particularly high impact or repetitive activities, can place stress on the joints and potentially lead to joint discomfort or inflammation. In this context, some highly trained individuals may still consider glucosamine and chondroitin supplements to support joint health and potentially mitigate exercise-induced joint stress. Individual experiences and anecdotal evidence from athletes and highly trained individuals suggests that glucosamine and chondroitin supplementation may be helpful in reducing joint discomfort, supporting joint integrity, and aiding in recovery from intense exercise. However, more research is needed to establish the specific benefits and mechanisms of action in this population. It's important to remember that dietary supplements, including glucosamine and chondroitin, should not replace a comprehensive approach to joint health. Maintaining proper training techniques, implementing appropriate warm-up and cool-down routines, using protective equipment, and ensuring adequate rest and recovery are all important aspects of joint health for highly trained individuals. The Glucosamine Chondroitin Arthritis Intervention Trial, or GATE, is conducted by the National Institutes of Health, or NIH, examined the effectiveness of glucosamine and chondroitin supplements for knee osteoarthritis. The study aimed to determine whether these supplements were effective in reducing knee pain and improving joint function. The GATE study included a large number of participants with knee osteoarthritis and found that overall there was no statistically significant reduction in knee pain compared to the placebo in the entire study population. However, a subgroup analysis revealed that individuals with moderate to severe knee pain did experience significant pain relief when taking the combination of glucosamine and chondroitin compared to placebo. This finding suggests that glucosamine and chondroitin supplements may have a more notable impact on pain reduction in individuals with more severe knee osteoarthritis symptoms. It is important to note that the Gates study focused specifically on knee osteoarthritis, and the results may not necessarily apply to other joint conditions or populations. It's also worth noting that scientific research on glucosamine and chondroitin supplements remains somewhat inconsistent, with some studies showing positive effects on pain relief and joint function, while others show no significant benefits compared to placebo. The variability in results may be due to factors such as differences in study design, dosage, and duration, as well as variations in individual responses. When considering the use of glucosamine and chondroitin supplements, it's always important to keep the following precautions and recommendations in mind. Before starting any new dietary supplement, including glucosamine and chondroitin, it's advisable to consult with a healthcare professional or a qualified medical practitioner. They can provide personalized advice based on your client's individual health status, medications that they are taking, and any pre-existing medical conditions. You always want to choose supplements from reputable manufacturers or brands that adhere to good manufacturing practices, the GMP, and have undergone third-party testing for quality and purity. Look for supplements with proper labeling that clearly states the ingredients, dosage, and manufacturing information. Glucosamine supplements are often derived from shellfish shells, so individuals with shellfish allergies should exercise caution or consider alternative sources of glucosamine, such as those derived from non-shellfish sources or that are synthetically produced. Chondroitin supplements are often made from animal sources, so individuals with specific animal protein allergies should also take this into consideration. Glucosamine and chondroitin supplements are generally considered safe for most individuals. However, some people may experience mild side effects such as digestive issues, like an upset stomach or diarrhea. If you experience any adverse effects, or you want to make sure that your client discontinues use and consults with their healthcare professional. Glucosamine and chondroitin may interact with certain medications such as blood thinners like warfarin and diabetes medications. It's important to make sure that they inform their healthcare professional about all medications and supplements they are taking to avoid potential interactions. Glucosamine and chondroitin supplements may take time to show noticeable effects, typically several weeks or months. Consistent and long-term use may be necessary to determine their potential benefits. Results can vary among individuals, and not everyone may experience significant improvements. Glucosamine and chondroitin supplements should not be seen as standalone solutions for joint health. Again, you want to make sure that your client is getting regular exercise, maintaining a healthy weight, using proper joint protection techniques, and following a balanced diet. That's crucial for overall joint health. And remember that dietary supplements, including glucosamine and chondroitin, are not regulated in the same way as pharmaceutical drugs. It's important to make informed choices, seek professional advice, and monitor the body's response to any supplement that they decide to take. Creatine is a naturally occurring compound found in small amounts in certain foods, such as meat and fish, and is also produced by the body. It plays a crucial role in energy metabolism, particularly in high-intense, short-duration activities, by providing a phosphate group to replenish adenosine triphosphate, or ATP, the primary energy source for muscle contractions. Creatine supplements such as creatine monohydrate are commonly used by athletes and individuals involved in high-intensity sports and resistance training. Creatine supplementation has been extensively studied and has been shown, this is exciting, to improve various aspects of exercise performance, particularly in activities that require short bursts of high-intensity effort, such as weightlifting, sprinting, and jumping. It has been associated with increased strength, power, muscle endurance, and the ability to perform more repetitions during resistance training. Creatine supplementation may also contribute to muscle growth and hypertrophy. By increasing the availability of phosphocreatine, creatine can enhance the ability to perform intense exercise and potentially stimulate muscle protein synthesis, leading to an increase in muscle mass over time. Creatine supplementation has been suggested to improve recovery from intense exercise by replenishing ATP stores and reducing muscle damage and inflammation. It may also help buffer lactic acid accumulation, delaying the onset of fatigue during high-intensity exercise. The most common method of creatine supplementation involves initial loading phase, followed by a maintenance phase. During the loading phase, individuals typically consume higher doses of creatine, around 20 to 25 grams per day, for 5 to 7 days to saturate the muscles with creatine. After the loading phase, a maintenance dose of 3 to 5 grams per day is typically used. Creatine supplementation is generally considered safe for healthy individuals when used within recommended dosages. However, some individuals may experience gastrointestinal issues of bloating, cramping, and diarrhea when consuming high doses, or have pre-existing medical conditions that may require caution. It's important to stay well hydrated when taking creatine to minimize the risk of potential side effects. It's important to note that responses to creatine supplementation can vary among individuals. And while many individuals experience performance benefits, not everyone may respond in the same way. Genetic factors, training status, diet, and other variables can influence individual responses to creatine. Creatine supplements are available in various forms, with the most common and well-researched form being creatine monohydrate. Here are some of the different forms of creatine supplements. Creatine monohydrate is the most widely used and researched form of creatine. It consists of a creatine molecule bonded with a water molecule. It's generally considered safe, effective, and cost-efficient. Creatine monohydrate has a good absorption rate and is typically taken in powder form mixed with water or other fluids. Creatine ethyl ester is a modified form of creatine that is claimed to have a better absorption and stability. However, research has shown that CEE may not offer any significant advantages over creatine monohydrate in terms of effectiveness or absorption. It is less commonly used compared to creatine monohydrate. Buffered creatine, also known as crealkaline, is a creatine monohydrate that has been buffered to make it less acidic. The idea behind buffered creatine is to enhance stability and reduce the conversion of creatine to creatinine, a byproduct in the acidic environment of the stomach. However, there is limited scientific evidence supporting significant advantages of buffered creatine over creatine monohydrate. Micronized creatine refers to creatine monohydrate that has been processed into smaller particles for enhanced solubility and easier mixing. This form is intended to improve absorption and reduce the risk of stomach discomfort associated with standardized creatine monohydrate. Micronized creatine is available as a powder and is often preferred by individuals who want a finer texture. Liquid creatine supplements come in pre-mixed liquid form, typically in bottles or vials. They come to provide better absorption and convenience. However, there is limited scientific evidence to support superior absorption or efficacy compared to powdered forms of creatine. It's worth noting that while different forms of creatine supplements exist, creatine monohydrate remains the most widely researched form with established effectiveness and safety. The other forms may have specific marketing claims, but the scientific evidence supporting their advantages over creatine monohydrate is limited or inconclusive. Creatine supplementation is based on the theory that increasing the body's creatine stores can provide several benefits related to energy production and exercise performance. Adenosine triphosphate, or ATP, is the primary energy source used by muscles during high-intensity exercise. However, ATP stores are limited and can be quickly depleted. Creatine plays a crucial role in replenishing ATP stores by providing a phosphate group to reform ATP through the process of phosphorylation. By increasing creatine levels, the theory suggests that there will be a greater availability of phosphocreatine, or PCR, to rapidly regenerate ATP during intense exercise. By enhancing the ATP PCR system, creatine supplementation may improve the availability of energy for high-intensity, short-duration activities. This can lead to improved performance in explosive movements such as sprinting, jumping, and resistance training exercises. Creatine supplementation has been associated with increased muscle strength and power output. This may be attributed to improved energy availability and enhanced muscle contractile function during high-intensity activities. Creatine supplementation has also been suggested to promote muscle hypertrophy, which is an increase in muscle size, due to increased training intensity and volume enabled by improved energy production. It may contribute to greater gains in lean muscle mass over time, particularly when combined with resistance training. Some evidence suggests that creatine supplementation can delay the onset of fatigue during repetitive and high-intensity efforts. By increasing energy availability, it may help to buffer the buildup of lactic acid and reduce fatigue during prolonged exercise. It is important to note that the theory behind creatine supplementation is supported by a considerable body of scientific research. Numerous studies have demonstrated the performance-enhancing effects of creatine supplementation, particularly in activities that rely on the ATP-PCR system. However, it's worth considering that individual responses to creatine supplementation can vary, and not all individuals may experience the same benefits. Factors such as genetics, training status, diet, and specific exercise protocols can influence individual responses to creatine supplementation. The recommended protocol for creatine supplementation typically involves two phases, a loading phase and a maintenance phase. The loading phase is typically 5 to 7 days, and the idea is to consume approximately 20 to 30 grams per day of creatine monohydrate divided into 4 to 5 equal doses. You want to spread the doses throughout the day to ensure consistent creatine saturation in the muscles. During the loading phase, the goal is to saturate the muscles with creatine and rapidly increase their creatine stores. For the maintenance phase, this is after the loading phase, you're going to consume about 3 to 5 grams of creatine monohydrate per day. Take the daily maintenance dose at a time that is convenient, and it can be all at once or divided into smaller doses throughout the day. The maintenance phase is intended to maintain the elevated creatine levels in the muscles over time. It is worth noting again that some individuals may choose to skip the loading phase and start with the maintenance phase directly. While the loading phase can expedite the saturation of creatine stores, it's not essential for everyone. Creatine can be taken at any time of the day. Some people prefer to take it around workouts to ensure it is available during exercise, while others take it at a consistent time each day. Creatine monohydrate is typically available in powder form. You want to mix it with water or non-acidic beverage of your choice for consumption. It is important to stay well hydrated when taking creatine to support its effectiveness and minimize the risk of potential side effects. And make sure that your client's drinking plenty of water throughout the day. Creatine supplementation has been shown to have an ergogenic effect on tasks that heavily rely on the PCR energy system. The PCR system provides rapid energy for short duration, high intensity activities such as sprinting, jumping, and resistance training. Creatine supplementation increases the intramuscular stores of creatine and phosphocreatine. This allows for a greater availability of PCR during high-intensity activities, resulting in enhanced energy production through ATP resynthesis. With more PCR available, the resynthesis of ATP, which is the primary energy currency in cells, can occur at a faster rate. This improved ATP regeneration supports the energy demands of explosive movements and helps maintain performance during repetitive bouts of high-intensity exercise. The greater availability of PCR and improved ATP regeneration can lead to increased power and strength output during activities that heavily rely on the PCR system. This can translate into improved performance in activities like sprinting, jumping, and weightlifting. Creatine supplementation has been associated with a delay in the onset of fatigue during high-intensity tasks. This can potentially allow individuals to sustain higher power output for longer duration, leading to improved performance and increased work capacity. It's important to note that the ergogenic effects of creatine supplementation are more pronounced in tasks that primarily rely on the PCR energy system. Activities that involve longer durations or primarily rely on other energy systems may not benefit as significantly from creatine supplementation. It's also worth considering that individual responses to creatine supplementation can vary. Some individuals may experience greater improvements in power and strength, while others may see more modest effects. Again, genetics, training status, diet, and specific exercise protocols can influence individual responses. The ergogenic effects of creatine supplementation on tasks dependent on the PCR energy system can be applicable to various sports and activities. Creatine supplementation has been shown to enhance power and strength, which can be advantageous for weightlifting exercises that require explosive movements such as the clean and jerk and snatch and heavy lifts. Sports that involve short bursts of high intensity effort such as sprinting can benefit from supplementation. The increased availability of PCR and improved ATP regeneration can enhance power output, speed, and overall performance during these intense activities. Soccer involves a combination of high-intensity sprints, change of direction, and repeated explosive movements. Creatine supplementation may contribute to improved performance in these aspects by providing additional energy for quick bursts of power and facilitating faster recovery between intense actions. It's important to note that the benefits of creatine supplementation in these sports are more apparent during short duration, high intensity efforts rather than prolonged endurance activities. Sports that rely heavily on aerobic metabolism, such as long distance running or cycling, may not experience the same degree of ergogenic effects from creatine supplementation. Creatine supplementation primarily targets the PCR energy system, as we've been talking about, which again is responsible for providing rapid energy during short duration and high intensity activities. The PCR system is not directly involved in the lactic acid energy system, which relies on the breakdown of glucose without the involvement of creatine. While creatine supplementation may not directly impact the lactic acid energy system, it can still directly influence performance during activities that involve lactic acid production. Creatine supplementation has been shown to improve performance in high-intensity activities, even if they primarily rely on the lactic acid energy system. By improving power output and delaying fatigue, creatine supplementation can help individuals sustain higher intensities and workloads during activities that produce lactic acid. Creatine supplementation may also aid in the replenishment of ATP stores during recovery periods between high-intensity efforts. This can be beneficial for sports that involve repeated bouts of intense exercise, allowing athletes to recover faster and maintain performance levels throughout the activity, such as soccer. While not a direct effect of creatine supplementation, the improved performance and delayed fatigue associated with creatine's use may directly contribute to a better buffering capacity against lactic acid accumulation. By maintaining higher power output and delaying the onset of fatigue, athletes may be able to tolerate higher levels of lactic acid before experiencing performance decrements. Again, it's important to note that the lactic acid energy system is primarily involved in activities of moderate to high intensity and durations ranging from several seconds to a few minutes. While creatine supplementation can provide benefits during these activities, its effects may not be as pronounced as those on the PCR system. Individual responses, again, can vary and will depend upon factors such as genetics, training status, diet, and specific exercise protocols. Creatine supplementation, again, targets the phosphocreatine PCR energy system and does not directly affect the oxygen energy system or the aerobic metabolism. The oxygen energy system relies on the utilization of oxygen to produce ATP and is the primary energy system used during endurance activities. And while it may not directly impact the oxygen energy system, it can still have some indirect effects on endurance performance. So endurance activities such as long distance running or cycling often involve surges of high intensity efforts such as sprints or uphill sections. Creatine supplementation can enhance the availability of phosphocreatine, which can help facilitate these high intensity bursts within endurance activities. This may provide an advantage in certain race scenarios or during challenging sections of a course. It may also aid in recovery between endurance training sessions by replenishing ATP stores more efficiently. This can potentially lead to faster recovery, reduced muscle damage, and improved performance in subsequent training sessions. Although endurance activities primarily rely on the oxygen energy system, many endurance athletes incorporate strength and power into their routines to improve overall performance. So creatine supplementation helps enhance strength, power, and muscle mass, which can benefit endurance athletes during strength training sessions and potentially contribute to their overall improved performance. Again, it's important to note that the ergogenic effects are typically more pronounced with the PCR energy system with short duration and high intensity efforts, but benefits for endurance activities that predominantly utilize the oxygen energy system may not be as substantial. Creatine supplementation has been associated with an increase in body mass, primarily due to the increase in intramuscular water content. Creatine supplementation leads to increased water retention within the muscles. This occurs because creatine pulls water into the muscle cells as it is stored as phosphocreatine. This increase in intramuscular water content can contribute to an increase in body mass. Creatine supplementation has been shown to promote gains in muscle mass, primarily through enhanced training adaptations, increased strength, and improved recovery. This increase in muscle mass can also contribute to an increase in body mass. And while it has not directly been linked to changes in fat mass, when combined with resistance training, creatine may support improvements in body composition by promoting lean muscle gains. Increasing lean muscle mass can indirectly impact fat metabolism and contribute to overall body composition improvements. The effects of creatine on body mass can vary among individuals. Some individuals may experience more significant increases in body mass, primarily due to water retention, while others may have more modest changes. Again, genetic factors, training status, diet, and other individuals' factors can influence the response to supplementation. It's also important to note that the increase in body mass associated with creatine supplementation is primarily due to water retention and muscle mass gains, and not typically attributed to an increase in fat mass. Caffeine and creatine are two popular supplements used by athletes and individuals looking to enhance their exercise performance. While they can be taken individually, they are also commonly found together in pre-workout supplements or energy boosting formulations. Caffeine is a stimulant that acts on the CNS system, promoting alertness and reducing fatigue. It's commonly consumed in beverages like coffee, tea, and energy drinks. Caffeine has been shown to have several potential benefits for exercise performance, including increased endurance, improved focus and concentration, and enhanced fat oxidation. Creatine, again, is a compound naturally produced in the body and found in certain foods, and it plays a crucial role in energy metabolism, particularly during those high intensity, short duration activities. And supplementation has been associated with increased strength, power, muscle mass, and improved performance in the high intensity activities that rely on that PCR system. Caffeine and creatine can be combined in a formulation typically found in pre-workout supplements or energy boosting products. One that was just in the news this last week was Prime. It's one that it was saying, I believe it had like 2,000 or 3,000 milligrams or micrograms of caffeine. Anyway, which is a ridiculous amount of caffeine and something to be very cautious about. Can make your athletes jittery or anxiety, that sort of thing. So you want to be very careful with that. These formulations often can contain other ingredients such as amino acids, vitamins, and minerals to enhance energy, focus, and exercise performance. The purpose of combining caffeine and creatine is to potentially provide synergistic effects on exercise performance and fatigue reduction. The combination of caffeine and creatine in a formulation may offer potential benefits for exercise performance. Caffeine can provide an immediate energy boost and enhance focus, while creatine can support increased strength and power output. Together, they may help improve performance in high-intensity activities and delay the onset of fatigue. Again, you have to be very careful about individual sensitivity to caffeine and creatine and carefully follow dosage recommendations. Some individuals may be more sensitive to the effects of caffeine and may experience side effects such as jitteriness, increased heart rate, or disrupted sleep. Creatine supplementation also requires proper dosage, timing, and to ensure optimal effects. So before starting any supplementation, including caffeine and creatine, it's always advisable to consult with your healthcare professional or a sports nutritionist that can provide personalized advice based on your client's needs, goals, and health status, and help to determine the most appropriate dosages, timing, and potential formulations that suit their specific circumstances. Prime also has a product that does not have all the caffeine. It's more of the hydration versus it has like 20 milligrams of 20 calories, excuse me. But it does not have any caffeine compared to the other versions. So you want to be again, a cautious consumer. Creatine supplementation has been extensively studied and is generally considered to be safe for healthy individuals when used within recommended dosage. Creatine is primarily metabolized and excreted by the kidneys, so concerns have been raised that creatine supplementation could potentially strain the kidneys and impair kidney function. However, numerous studies have shown that the short-term use of creatine within recommended dosages does not promote significant risk to kidney function in healthy individuals with normal kidney function. Creatine is not metabolized in the liver, and research suggests that creatine supplementation does not have adverse effects on liver function in healthy individuals. Studies have not shown any significant changes in liver enzymes or markers of liver damage with creatine supplementation with recommended dosages. Gastrointestinal distress, such as bloating, cramping, and diarrhea, can occur in some individuals who take creatine supplements. Some of the reasons behind that and some tips to minimize the side effects are with supplementation, make sure that the creatine supplementation can cause water to be drawn into the muscles, potentially leading to a dehydration if adequate fluid intake is not maintained. Dehydration can contribute to gastrointestinal distress. It's important to stay well hydrated when taking creatine supplements by drinking plenty of water throughout the day. Taking excessive amounts of creatine in a single dose or exceeding the recommended daily dosage can increase the risk of gastrointestinal distress. Stick to the recommended dosages provided by reputable sources and the specific product that your client's using. Some individuals may experience gastrointestinal issues when taking creatine on an empty stomach. Taking creatine with meals or spreading the dosage throughout the day may help and minimize gastrointestinal distress. And each person's tolerance to creatine can vary. Some may be more susceptible to gastrointestinal issues compared to others. If your client can experience persistent or severe gastrointestinal, it's advisable to consult with a healthcare professional. They can help assess whether creatine supplementation is suitable for them and provide personalized guidance. And if they continue to experience persistent gastrointestinal distress with creatine monohydrate, might consider trying an alternative form of creatine, such as micronized creatine or creatine hydrochloride. These forms are marketed as having better solubility and potentially reduced gastrointestinal side effects in some individuals. However, individual responses can vary, so it's important to make sure to monitor your client's body's response. And if they are new to creatine supplementation, it may be helpful to start with a lower dosage and gradually increase it over time. This can help their body adapt to the supplement and potentially reduce the likelihood of gastrointestinal distress. Dehydration, muscle cramps, and tears are potential concerns that can arise in relation to exercise and athletic performance. While creatine supplementation itself is not a direct cause of these issues, it is something that it can cause, again, increased water retention within the muscles. This means it's important, again, to maintain adequate hydration when taking creatine to support the body's fluid balance. Insufficient fluid intake, particularly during exercise, can contribute to dehydration, which may lead to muscle cramps and other issues. It's crucial to drink plenty of water throughout the day, especially when engaging in physical activity. Muscle cramps can occur due to various factors, including inadequate hydration, electrolyte imbalances, and muscle fatigue. While creatine supplementation itself is not directly associated with those things, imbalances in electrolytes such as sodium, potassium, and magnesium due to inadequate fluid intake or excessive sweating can increase the likelihood of experiencing muscle cramps. Ensuring, again, proper hydration and electrolyte balance through a well-balanced diet, and if needed, electrolyte-rich beverages or supplements can help minimize the risk of muscle cramps, like Gatorade, something along that line that has some electrolytes with it. Muscle tears, also known as muscle strains, can occur due to various factors, including inadequate warm-up and proper technique, overexertion, and insufficient recovery. Creatine supplementation, again, does not directly cause muscle tears. However, if an individual experiences increased strength or power gains from creatine supplementation, it's important to gradually adjust training intensity and volume to minimize the risk of overexertion and potential muscle tears. Proper warm-up, correct form, and adequate rest and recovery are also crucial in preventing muscle tears. It's important to note that while creatine supplementation is generally considered safe, individual responses and experiences can vary. Overdosing on creatine is unlikely when used within recommended dosages. However, it's important to adhere to proper dosage guidelines to ensure safe usage. Creatine supplementation typically involves that loading phase of around 20 to 30 grams per day for 5 to 7 days, followed by a maintenance phase of 3 to 5 grams per day. It's important to follow those recommended dosages provided by reputable sources and the specific product that your client's using. Exceeding those dosages can increase the risk of potential side effects and may not provide additional benefits. Taking excessive amounts of creatine may lead to gastrointestinal distress that we talked about, so bloating, cramping, and diarrhea. Additionally, very high doses of creatine can potentially place additional stress on the kidneys. So to minimize those risks, it's important to stick to the recommended dosages and consult with a healthcare professional if your client has any concerns. As with any dietary supplement, there is a possibility of contamination with impurities and contaminants. It's important to choose supplements from a reputable manufacturer or brands that adhere to good manufacturing practices. You have to look for those products that have undergone third-party testing for quality, purity, and absence of contaminants. These independent tests can help ensure the safety and quality of the product. While creatine is commonly known for its use as a sports and exercise supplement, it also has medical applications as well. It has been studied for its potential benefits in various neurological conditions such as Parkinson's disease, Huntington's disease, and amyotrophic lateral sclerosis, or ALS. Research suggests that creatine may have neuroprotective properties, support energy metabolism in the brain, and potentially improve motor function and cognitive performance in certain neurological conditions. Creatine supplementation has been investigated as a potential treatment for certain muscle disorders, including muscular dystrophies and mitochondrial myopathies. It may help improve muscle strength, increase muscle mass, and enhance functional capacity in individuals with these conditions. However, it's important to note that the effects of creatine supplementation can vary among different types of muscle disorders, and its use should be discussed with a healthcare professional. Some studies have explored the use of creatine supplementation in individuals with chronic heart failure. Creatine may enhance exercise capacity, improve muscle strength, and support cardiac function in these patients. However, further research is needed to determine its effectiveness and safety in this population. Creatine supplementation has also been investigated as a potential intervention for age-related muscle loss or sarcopenia. It may help increase muscle mass, strength, and functional performance in older adults. However, again, more research is needed to establish the efficacy and safety of creatine supplementation for sarcopenia. And that is all that I have for you today. I look forward to talking with you again. Y'all have a great day.